According to Wikipedia.org, social injustice is a concept related to the claimed unfairness or injustice of a society and its divisions of rewards and burdens and other incidental inequalities. Some barriers that prevent us from turning social injustice into social justice include prejudice, discrimination, oppression, racism, classism, and stereotyping. One of the most important social injustices of our time, one that most people do not readily recognize, is health disparities. According to chronicdisease.org, health disparities are differences in the incidence, prevalence, mortality, burden of disease, and other adverse health conditions or outcomes that exist among specific population groups in the United States. Health disparities can affect population groups based on ethnicity or socioeconomic status, and most often occur among groups who have persistently experienced historical trauma, social disadvantage or discrimination, and systematically experience worse health or greater health risks than more advantaged social groups. In simpler terms, based on your social class and/or race, you are more likely to get sick and die than someone who makes more money than you do, lives in a better neighborhood than you do, and can afford better health care than you can. In my interview with Dr. Lee Green, Vice President of Moffitt Diversity, an expert in the injustice of health disparities, he told me that people rely on free health care because of the rising cost of health care in these neighborhoods.
It was here at the Moffitt Cancer Center that I spoke to Lee Green about health disparities. We discussed several causes of health disparities in this country, one of them being the fact that minorities are more prone to certain health-related issues than Caucasians. Lee Green believes this is caused by stress.
The stress of having to work harder, longer hours, just to live in a run-down, ramshackle neighborhood, such as this one. Not everybody is trapped. Some do make it out to a better life. However, most are bogged down by the stress of ending up extremely poor and malnourished, or the stress of ending up homeless.
People argue that Obama's newest plan to reform healthcare in this country is nothing but a handout to those who are lazy. Lee Green believes different. He believes that we're simply helping those who can't pay for good healthcare themselves.
What about the people who live in that neighborhood? Can they pay for healthcare? Or what about the people who pay for that? Can they pay for healthcare? Or what about the people who live in that gated community? Can they pay for healthcare? Or what about the people who live in this neighborhood? Do you think they can afford healthcare? But then what about the people who live in this area? That's the basis for fighting health disparities. By making healthcare affordable to everyone of every race and every social class, we can end the social injustice of health disparities.